let's just kind of jump to this recovery for patients after like more major surgery. Any tricks, anything that you're doing? I know that you use drains, I think, for certain things, right? I'd like to use drains too.
Yeah.
Anything else, or what are your thoughts on trying to speed up recovery for?
Yeah, I try everything I can, really. I mean, we do the Connect thing. I think that
Which one?
Connect, it's God, what is the herbal thing in it? I'm talking. I forget off the top of my head.
Arnica? Or no.
Yeah, Arnica. Yeah, it's
Okay.
just
Okay. Yeah.
the brand. It's like the brand of that. So
Oh, okay.
we do Arnica. I think there's mixed, literature on that.
Yeah.
Something
Who knows?
it
Yeah.
works, some it doesn't. This certainly doesn't hurt. I've started using a lot of TXA in my tumescent solutions. I do think that helps a little bit with swelling and bruising. Intra-op stuff, I think also just a good concentration of epi helps a lot. I have definitely increased as I've gone along. Actually, in my fellowship, we used a lot more than I had used back when I was in my residency, and I did notice a lot less bruising and swelling. Giving it local time to sit before you start. Other things we can do. Sometimes I do, if it's a healthier person, we will keep them a little more on the hypotensive side during surgery if they can tolerate it, just to decrease bruising and swelling. Afterwards, the standard stuff: head of bed elevation,
Sure.
good wrap on especially on my face tight cases and things like that. Now where I'm trying to contour, I use toppy foam, just kind of like you would use for the abdomen, and I cut it out to the areas I want. And then I make sure that's on for at least a good 24 hours to kind of keep those areas bolstered so you don't get any residual hematoma or anything. Because I have noticed sometimes if you do, this just don't get a great result. It's not as profound. So that has been a cool one I've added. Let's see, what else have we really been doing? I use platelet-rich fibrin on any of my like skin resurfacing cases. I do definitely notice a difference. Incisions too, on like lip lifts. I'll usually inject the lip lift or after that, or any incision that is going to like show, I'll use that. And then I've been doing a lot of laser assisted drug delivery for like fine tuning scars and things like that afterwards with like 5FU and just a light fractional CO2. I think you can really blend away sometimes some incisions nicely with that. So
Nice.
that's the main stuff I've been doing. I don't know if you've been doing anything new or anything cool.
Yeah, I mean, I've just started to experiment with the jet peel, which is that system I was using for the PRP, needleless sort of entry of any kind of fluid. But you can also use it for lymphatic drainage massage, and that's the thing
I
that's
think that's a great
nice
idea too.
for the
Yeah,
neck.
I agree with you
Yeah,
100%.
yeah, just to kind of promote that drainage, and
Yep.
you just have like a different way of delivering it compared to like if you're like really transfusing liquid. It's nice. I mean, it's pressured air, and I think it works. I mean, I haven't treated so many patients to really tell if it's doing a lot, but people also like to feel like when they're recovering, especially from a bigger procedure, that you're there for them, and you're kind of guiding them
Oh
along.
yeah.
So
Yep.
coming in for certain smaller little treatments, people are usually very happy to do that.
Yeah, I'm 100% with lymphatic massage. We haven't started instituting it yet, but I just had this discussion actually when I was training for my face diet out in Arizona. Shapiro was the guy who trained me out there, and he's really big on it. Gave me the brochure he gets from his office and said you should really look into this. So I think there's definitely something for it. I know, I mean, for body stuff, it's amazing and very important, honestly, for any liposuction things. So I definitely think it probably speeds healing, helps get rid of that because the edema is the biggest.
Oh yeah,
Facial surgery doesn't really hurt. I mean, it's not
yeah.
exquisitely painful. It's just the swelling.